Comminuted fracture. Comminuted to reduce to powder or to pulverize from Latin word minura to lessen in is one in which there are two or more intersecting lines of fracture which divide the bone into three or more fragments. Salient features caused by fall from height on a hard surface, hoof of an animal kicks, vehicular accidents, weapons with a large striking surface, axe, cricket ball, cricket bat, heavy iron, bar, hockey stick, poker, often resembles a spider web or mosaic pattern. Spider web fracture or mosaic fracture, if the fragments are pushed inward, it would be called a depressed comminuted fracture. Sometimes small pieces may be lodged in the brain. Lines of fissured fracture are often seen radiating outward from a comminuted fracture. Next is a depressed fracture. Depressed fracture is a fracture in which the fractured bone is driven inward into the skull cavity. Salient features produced by the local deformation of the skull causes weapons are typically produced by a heavy weapon with a small striking surface. As example, axe, chopper, hammer, spanner, thick stick, rod, stone. Other causes fall on a sharp corner pieces of furniture. Outer table is driven into the diploe, and the inner table shows a comminuted fracture. Rarely on the inner table may be involved, leaving the outer table intact. Depth of the fracture is directly proportional to the force of impact. Signature fracture. Next is signature fracture. Fracture alloy signature is a special variant of depressed fracture in which the shape of the fracture mirrors the striking surface of the weapon. Medically, they are very important because they can reveal the weapon. In the case of a hammer, the fracture is a circular having a same diameter as a striking surface. When the butt of a firearm strikes the skull faced, the fracture is rectangular. When the corner of the butt strikes the fracture is triangular. Stone produces irregular and depressed fracture. A hit on the top of the head with a spanner would similarly cause a very characteristic. In the case of a hockey, the fracture assumes the shape of a hockey at the postmortem examination. It is important to preserve the fragment which can be later reconstructed for demonstrations. Identification of weapon from the signature fracture and compression of brain, severe dysfunction, a coma and death. Next is a diastatic fracture or a sutural fracture. Is the traumatic separation of a cranial bone at a suture line. Salient features age, commonly in young persons because of non-union of fractures. Sutures involved most commonly sagittal suture. Causes of blunt trauma associated with other fractures generally occurs along with other fracture may be seen. Elevated fracture. Elevated fracture, that is the skull pieces are pushed outward. Very rare, causes a long, sharp wounding object. Example, a machete elevate the fracture fragment by a lateral pull of the object or rotation of the head. Through penetration of the skull. The exit wound causes a elevated fracture. Exit wound causes elevated fracture. The elevation of the free fragment while retrieving the weapon. Tangential force applied to the calvarium associated with the rotation. Burns. The pressure of gases from inside causes outward displacement of the skull fragment. Next is a fissured fracture. Next is what is diploe outer table thickness and inner table compare. Diploid എന്ന് പറയുന്നത് ഔട്ടർ ടേബിൾ ഇന്നർ ടേബിളിന് ഇടയ്ക്കുള്ള സാധനമാണ്. ദർ ഈസ് ഡിപ്ലോയിക് വെയിൻസ് ഈസ് ദിയർ, വാൽവുലസ് ആണ്, ഇലാസ്റ്റിക് soft cancellous spongy portion is there, red bone marrow. This is fissured fracture. Is a linear fracture involving the whole thickness of the skull or only the inner or outer table. Salient features, frequency, most common type of skull fracture. Most common type is that. Mechanism, general deformation of skull caused by forcible pressure against a broad resisting surfaces, as in blow with a weapon with a large striking surfaces fall on the ground or flat surface on one or several fracture lines are radiating from the point of the impact. Head is fixed. If head is fixed, the head, if the depression of bone fragment may not be seen. Okay. Movement of head. Head is free to move. Head is free to move. Fracture starts at the point of impact. The head is fixed. If head is fixed as the person is sleeping on the ground, if the head is sandwiched between the weapon and the hard surfaces, in such cases, fracture line start at a point opposite to the fracture line opposite to the site of impact. Sometimes skull may get ballooned out between the two pressure points. A fracture line may be start at the base of the skull commonly or at the vertex. Commonly at the base actually. Commonly at the base. Okay. Commonly at the base. Commonly at the base. Most common at the base actually. Okay. Or less commonly at the vertex. Also. Okay. Line of fracture runs parallel to the axis of compression. Okay. Associated with other fracture may be found in alone. Other type of fracture may be found only in the inner table. Only on the inner table. Maybe this happens because after impact, the more resilient outer table rebounds back its original shape, while the more brittle inner table fracture. The site of fracture may be indicated by extensive scalp hematoma. Characteristics of fracture line: breadth, hair's breadth, scores irregular. Sometimes it reaches a suture, follows its course for a while, then starts its own way. Hemorrhage almost always present. This makes the fracture line a hook red. This is also a useful way to differentiate between antemortem and postmortem fractures. Red color can be used to dictate fracture at autopsies. Determination of a cause. As a broad rule, fracture caused by a fall are at the level of pinna, while those due to blow are above this level. Injuries at the top of head may indicate force direct overhead or fall. Okay, this is fissured fracture. Then is growing fracture. Growing fracture, also known as a craniocerebral erosions, is a rare complication of the skull fracture. Can be seen mainly during the first 3 years of life. Is characterized by a progressive enlargement of the fracture line. Salient features: growing enlargement of the fracture line. Salient features: the growing skull fracture were be first described by the Hauship Dyke 1930. Described the same fracture under the term leptomeningeal cyst. Incidence 0.05 to 1.5 skull fractures in childhood. Age more than 50% of GES growing skull occur under the age of the 12 month. 90% under the age of 3 years. Virtually never found after 80 years of life. Virtually found after 80 years. Bone involved usually located in the parietal bone. Separation usually seen in fractures where the separation at the time of injury is more than 4 millimeter. Time and enlargement occurs 4 to 8 weeks later. Why occurs during young group? Interposition of the dura in a fracture. Dura adhere more tightly to the bone in this age group, therefore is more easily torn in the skull fracture. Part of it gets interposed in the fracture line, preventing osteoblast from migrating to the fracture site, inhibiting healing. Most important cause. Interposition of the epidural hematoma in similar way. Lack of nutrition. Dura acts as a periosteum of the skull bone. Later blood supply is coming mainly from dural vessels. Laceration of the dura with or without interposition between the fracture pieces of skull interrupt its blood supply, causing nutritional deficiency of the skull bone. This result in enlargement of the skull defect. The enlargement starts from the inner table. The continuous pressure from tissue herniation through the bone gap. Rapid growth of the skull grows very rapidly during this period, preventing stability needed for fracture union. Raised intracranial pressure also. Next is a gutter fracture. Gutter fracture is a long, narrow fracture of the skull produced by the partial removal of the outer table. Salient features: causes most commonly due to glancing bullet. Number 8. Gutter fracture is by glancing bullet. The first degree gutter fracture, only the outer table of the skull is grooved by the bullet with the result in carrying away the small bone fragment. Second degree gutter fracture, in addition to above the pressure waves generated by the bullet fracture, the inner table irregular depressor fracture, dura mater and brain may be torn. Third degree gutter fracture, it is synonymous with the keyhole fractures. Bullets are still lower level, causes perforating wound where there is production of separate entrance and exit wound in the bone. Okay. Next is keyhole fractures produced by the bullet perforate the skull in the center of the tangential wound. The outer table is fragmented and there are depressed fragment of the inner table. If not combination and pulverization of both the tables in the center of the wound track, the fragments of the bone can be driven into the brain, causing death. The level of bullet influences the shape of the fracture. That is, bullet 1 going almost tangentially from left to right, just glance over the outer table without entering the skull, makes a gutter fracture of first degree. Bullet 2 slightly lower in a trajectory, entire skull and immediately comes out. Entry and exit merge with each other. Gutter fracture of third degree looks like a traditional keyhole. Beveling of the skull indicates the entry and exit wound. Next is perforating or penetrating fractures, causing firearm, pointed, sharp weapon, axe, dagger, knife, nail. Penetrating fractures characterize there is only one entry and a nail driven into the skull. Manner: accident, suicide, homicide due to supernatural beliefs. A case study: a 45-year-old female patient presented with a metallic nail in situ in the middle of her head, very close to right side of the midline. She was unconscious since the time of the injury. There was no history of vomiting, seizure. The relatives revealed that she had been suffering from a headache more on the right side for the last 10 years with exacerbation of off and on. They took the patient to the tantric, who hammered the nail into her head to get rid of this bad omen. The nail was removed under local anesthesia. The patient recovered fully. Perforating fracture characterized by there is an entry and exit. Firearm stab wound with a terminal. The size and shape almost clean out, respond with that of the cross section of the weapon. Okay. Next is a wound fracture or intended fracture. Wound fracture or intended fracture. A pond fracture is a circular or depressor fracture of the skull salient which occurs mostly in infants, appear like a dent of the skull, much like the indentation of a table tennis ball produced by a finger pressure. Also known as a ping pong fracture. Causes a blunt object to fall off an infant from lap of a mother, forcible impact against some protruding object. Obstruct takes forceps blade. Fracture commonly occur in the outer table around the periphery of the dent. The inner table is not fractured. Associated injuries. Dura mater is not torn. Usually brain is not damaged. Reduction. Negative pressure of about 0.8 kg applied with a vacuum extractor for about 5 minutes. Do not apply any traction. Next is a ring fracture or a foramen fracture is a circular depressor fracture around the foramen magnum salient features appears fissured fracture running 3 to 5 centimeter outside the foramen magnum all around the causes fall from height onto feet or buttocks. Most common body weight pressing upon the vertebral column on the base of the skull. Heavy weight falls on the vertex. Prognosis associated with the brain stem injuries. Thank you.